Question 1. A 6-month-old is brought to the emergency department with high-pitched crying, bulging fontanelle, and irritability. What is the nurse's priority action? A. Ask about recent feeding. B. Assess head circumference. C. Notify the healthcare provider. D. Administer a PRN analgesic. Answer. C. Notify the healthcare provider. Rationale. These are signs of increased intracranial pressure in infants. Immediate provider notification is crucial to prevent complications. Question 2. A 4-year-old child with croup presents with stridor and intercostal retractions. What is the most appropriate initial intervention? A. Administer an oral corticosteroid. B. Apply a cool mist vaporizer. C. Provide humidified oxygen. D. Perform nasopharyngeal suctioning. Answer. C. Provide humidified oxygen. Rationale. Humidified oxygen helps reduce airway inflammation and stridor. Suctioning can worsen laryngeal irritation. Question 3. The nurse is assessing a toddler with suspected epiglottitis. What is the priority action? A. Inspect the throat with a tongue depressor. B. Prepare for intubation. C. Administer nebulized epinephrine. D. Offer oral fluids to soothe the throat. Answer. B. Prepare for intubation. Rationale. Airway obstruction can occur rapidly. Inspection may worsen the condition. Airway stabilization is the priority. Question 4. A 10-month-old is hospitalized with bronchiolitis. Which finding should the nurse report immediately? A. Occasional wheezing. B. Mild nasal flaring. C. Apnea lasting 20 seconds. D. Fever of 38.2 degrees Celsius. Answer. C. Apnea lasting 20 seconds. Rationale. Apnea in infants is a serious concern and could indicate respiratory failure. Immediate intervention is required. Question 5. A 2-year-old with severe dehydration is receiving 4 fluids. What is the best indicator of fluid balance improvement? A. Increased appetite. B. Stable blood pressure. C. Moist mucous membranes. D. Absence of tears when crying. Answer. C. Moist mucous membranes. Rationale. Mucous membranes are a reliable indicator of hydration status in young children. Question 6. A child is receiving chemotherapy and the ANC is 300. What should the nurse do first? A. Administer the next dose. B. Encourage hand hygiene for all visitors. C. Isolate the child in a positive pressure room. D. Notify the healthcare provider immediately. Answer. D. Notify the healthcare provider immediately. Rationale. An ANC less than 500 is critical and places the child at high risk for infection. Treatment must be reassessed. Question 7. A nurse observes a 3-year-old with a possible fracture, refusing to bear weight on the left leg. What should the nurse do next? A. Encourage the child to walk. B. Apply heat to the leg. C. Notify the provider for further evaluation. D. Reposition the child for comfort. Answer. C. Notify the provider for further evaluation. Rationale. Refusal to bear weight may indicate a fracture. It requires immediate medical attention. Question 8. A nurse is teaching a parent how to administer oral iron drops to a 2-year-old. What instruction is most important? A. Mix the iron with milk to reduce stomach upset. B. Give the iron at bedtime with food. C. Use a straw or syringe to avoid tooth staining. D. Stop the iron if stool turns dark. Answer. C. Use a straw or syringe to avoid tooth staining. Rationale. Iron can stain teeth, and using a straw helps prevent this. Milk interferes with absorption. Question 9. A 6-year-old is found to have head lice. What is the best response by the school nurse? A. Exclude the child from school for 48 hours. B. Notify the local health department. C. Instruct the parent to begin treatment and notify close contacts. D. Recommend the child shave their head. Answer: C. Instruct the parent to begin treatment and notify close contacts. Rationale: immediate treatment and contact precautions are key. Exclusion is not required for 48 hours. Question 10. A nurse is evaluating the effectiveness of pain management for a nonverbal 18-month-old post-op patient. Which assessment tool is most appropriate? A. Wong-Baker-Faces scale. B. Flack scale. C. Numeric pain scale. D. Verbal rating scale. Answer: B. Flack scale. Rationale: the Flack scale is designed for nonverbal or pre-verbal children and assesses behavioral cues. Question 11. The nurse is preparing to administer a vaccine to a 12-month-old. Which site is most appropriate? A. Deltoid muscle. B. Dorsogluteal site. C. Vastus lateralis muscle. D. Ventrogluteal site. Answer: C. Vastus lateralis muscle. Rationale: the vastus lateralis is the preferred site for IM injections in children under 18 months due to muscle mass. Question 12. A child with type 1 diabetes is confused and sweating before lunch. What should the nurse do first? A. Check the child's temperature. B. Administer insulin. C. Give 15 grams of carbohydrates. D. Notify the provider. Answer: C. Give 15 grams of carbohydrates. Rationale: these are signs of hypoglycemia. Immediate glucose administration is the priority. Question 13. A nurse caring for a newborn with jaundice prepares for phototherapy. What is the priority nursing action? A. Feed the newborn every 4 hours. B. Apply eye protection over the newborn's eyes. C. Keep the infant clothed during therapy. D. Stop therapy when bilirubin decreases. Answer: B. Apply eye protection over the newborn's eyes. Rationale: eye protection is essential to prevent retinal damage from phototherapy lights. Question 14. A 5-year-old is crying after surgery and refusing to deep breathe. What is the best nursing approach? A. Withhold pain medication until breathing improves. B. Explain the importance of deep breathing. C. Provide an incentive spirometer and demonstration. D. Offer a stuffed animal to hold while practicing. Answer: D. Offer a stuffed animal to hold while practicing. Rationale: distraction techniques with age-appropriate tools help promote cooperation and reduce anxiety. Question 15. A nurse is reviewing safety with parents of a toddler. Which statement indicates a need for further teaching? A. We have safety locks on cabinets. B. We keep hot drinks out of reach. C. We allow him to play with small coins. D. We use a car seat with a 5-point harness. Answer: C. We allow him to play with small coins. Rationale: small objects like coins are choking hazards. This indicates a safety concern. Question 16. A 10-year-old with asthma complains of shortness of breath after exercise. The peak flow is in the red zone. What is the priority action? A. Encourage rest and fluids. B. Administer short-acting beta agonist. C. Notify the provider after 30 minutes. D. Monitor for improvement in 1 hour. Answer: B. Administer short-acting beta agonist. Rationale: red zone on peak flow indicates a medical alert. Immediate bronchodilator use is necessary. Question 17. A child with cystic fibrosis has thick secretions and decreased appetite. What is the nurse's best intervention? A. Encourage large meals. B. Offer high-protein snacks frequently. C. Provide fluids only after meals. D. Reduce salt intake. Answer: B. Offer high-protein snacks frequently. Rationale: Children with CF need high-calorie, high-protein nutrition due to malabsorption. Question 18. The parent of a 3-year-old asks how to prevent otitis media. Which teaching is most effective? A. Avoid giving bottles while the child is lying flat. B. Use cotton swabs to keep ears clean. C. Only breastfeed during illness. D. Avoid all dairy products. Answer. A. Avoid giving bottles while the child is lying flat. Rationale. Supine bottle feeding increases risk of fluid entering the eustachian tubes, causing infections. Question 19. A nurse assesses a newborn and notes nasal flaring, grunting, and intercostal retractions. What is the priority action? A. Apply a cardiac monitor. B. Begin chest physiotherapy. C. Suction the nares. D. Administer oxygen via hood. Answer. D. Administer oxygen via hood. Rationale. These are signs of respiratory distress. Oxygen support is the priority intervention. Question 20. A nurse notices that a 2-year-old post-op tonsillectomy patient is swallowing frequently. What should the nurse do first? A. Give ice chips for comfort. B. Reassess in 15 minutes. C. Inspect the throat for bleeding. D. Offer warm fluids. Answer. C. Inspect the throat for bleeding. Rationale. Frequent swallowing after tonsillectomy can indicate hemorrhage. Early detection is life-saving. Question 21. A nurse is caring for a toddler hospitalized with pneumonia who is crying and pulling at the oxygen mask. What is the best nursing intervention? A. Remove the mask and provide blow-by oxygen. B. Restrain the child's arms. C. Switch to nasal cannula oxygen. D. Encourage the parent to hold the child while keeping the mask on. Answer. D. Encourage the parent to hold the child while keeping the mask on. Rationale. A familiar caregiver can soothe the child, increase cooperation, and ensure effective oxygen delivery. Restraints are a last resort. Blow-by and nasal cannula may be insufficient. Question 22. A 10-month-old infant is brought to the ER with suspected dehydration. Which assessment finding requires immediate intervention? A. Decreased urine output. B. Sunken fontanelle. C. Absent tears. D. Capillary refill of 5 seconds. Answer. D. Capillary refill of 5 seconds. Rationale. A delayed capillary refill signals poor perfusion and possible hypovolemic shock, requiring urgent care. Other signs confirm dehydration, but are less emergent. Question 23. A nurse is teaching parents about preventing sudden infant death syndrome (SIDS). Which statement indicates correct understanding? A. I will place my baby on his stomach to sleep. B. My baby should sleep in my bed at night. C. I will keep soft toys and pillows out of the crib. D. I should use thick blankets to keep my baby warm. Answer. C. I will keep soft toys and pillows out of the crib. Rationale. Removing soft items reduces the risk of suffocation and SIDS. Babies should sleep on their backs in a separate but close crib. Question 24. A school-age child with type 1 diabetes is found unconscious at school. What is the nurse's first action? A. Call the child's parents. B. Administer subcutaneous insulin. C. Give a glucagon injection. D. Check the child's urine for ketones. Answer. C. Give a glucagon injection. Rationale. Unconsciousness likely indicates hypoglycemia. Glucagon raises blood glucose quickly. Insulin would worsen hypoglycemia. Question 25. A 6-year-old child is scheduled for a tonsillectomy. Which preoperative finding should the nurse report immediately? A. Recent tooth loss. B. Mild sore throat. C. Loose front tooth. D. History of frequent nosebleeds. Answer. D. History of frequent nosebleeds. Rationale. Frequent nosebleeds suggest a bleeding disorder, which increases surgical risk and must be evaluated preoperatively. Question 26. A nurse caring for a child with leukemia notes a fever of 38.5 degrees Celsius. What is the nurse's priority action? A. Administer antipyretic. B. Encourage oral fluids. C. Notify the healthcare provider. D. Apply cool compress. Answer. C. Notify the healthcare provider. Rationale. Fever in immunocompromised children is a sign of possible sepsis. Immediate reporting is critical. Antipyretics and fluids come after physician direction. Question 27. A nurse is caring for a 5-year-old with nephrotic syndrome. Which findings should be reported immediately? A. Proteinuria. B. Periorbital edema. C. Weight gain of 1.5 kilograms in 24 hours. D. Decreased appetite. Answer. C. Weight gain of 1.5 kilograms in 24 hours. Rationale. Rapid weight gain indicates worsening fluid retention, which may lead to complications like pulmonary edema. Question 28. A child with suspected epiglottitis is crying and drooling. What is the priority nursing action? A. Assess throat using a tongue blade. B. Prepare for emergency intubation. C. Encourage the child to lie down. D. Suction oral secretions. Answer. B. Prepare for emergency intubation. Rationale. Epiglottitis can cause sudden airway obstruction. Invasive throat assessment can worsen it. Airway management is the top priority. Question 29. A nurse is assessing a 6-month-old infant. Which finding is concerning and should be reported? A. Unable to sit with support. B. Stranger anxiety. C. No response to sound. D. Rolling from tummy to back. Answer. C. No response to sound. Rationale. Lack of response to sound suggests possible hearing impairment or neurological issue and requires immediate evaluation. Question 30. A parent refuses the recommended MMR vaccine for their 15-month-old due to fear of autism. What is the nurse's best response? A. Vaccines are mandatory. B. Let's talk about what concerns you about the vaccine. C. You can wait until your child is older. D. You are harming your child. Answer. B. Let's talk about what concerns you about the vaccine. Rationale. Therapeutic communication allows the nurse to respectfully explore misconceptions and provide accurate information. Question 31. A 3-year-old post-op patient cries and guards his abdomen during assessment. What should the nurse do first? A. Document the behavior. B. Administer prescribed analgesic. C. Encourage deep breathing exercises. D. Notify the healthcare provider. Answer. B. Administer prescribed analgesic. Rationale. Guarding and crying suggest pain. Prompt pain management improves comfort and facilitates further assessment. Question 32. A child on 4 antibiotics develops swelling and redness at the 4 site. What is the nurse's immediate action? A. Elevate the extremity. B. Flush the 4 line. C. Stop the infusion. D. Apply a warm compress. Answer. C. Stop the infusion. Rationale. Redness and swelling suggest infiltration or phlebitis. Stopping the infusion prevents further tissue damage. Question 33. A child has been diagnosed with bacterial meningitis. What is the most important action when admitted? A. Elevate the head of the bed. B. Initiate seizure precautions. C. Administer analgesics. D. Start isolation precautions. Answer. D. Start isolation precautions. Rationale. Bacterial meningitis is highly contagious. Isolation helps prevent spread until ruled out. Question 34. A nurse notes a murmur in a newborn during assessment. What is the priority nursing action? A. Schedule an echocardiogram. B. Reassess during next shift. C. Notify the healthcare provider. D. Monitor oxygen saturation. Answer: C. Notify the healthcare provider. Rationale: new murmurs in newborns can indicate congenital heart defects. Prompt evaluation is essential. Question 35. A child with cystic fibrosis is admitted with a productive cough and fever. What is the nurse's priority intervention? A. Administer bronchodilators. B. Obtain a sputum culture. C. Encourage fluid intake. D. Perform chest physiotherapy. Answer: B. Obtain a sputum culture. Rationale: identifying the organism guides antibiotic therapy. Other interventions support respiratory function but are not first. Question 36. A child on digoxin presents with vomiting and bradycardia. What should the nurse do first? A. Administer the next digoxin dose. B. Hold the medication and notify the provider. C. Give an antiemetic. D. Encourage fluid intake. Answer: B. Hold the medication and notify the provider. Rationale: vomiting and bradycardia suggest digoxin toxicity. The medication must be withheld and reported immediately. Question 37. A nurse is preparing to administer a vaccine to a 4-year-old. What is the best action to reduce anxiety? A. Avoid telling the child it will hurt. B. Have the parent hold the child. C. Allow the child to play with the syringe. D. Use a toy to distract during the injection. Answer: D. Use a toy to distract during the injection. Rationale: distraction techniques help reduce procedural anxiety in preschoolers. Honesty and support from parents are also helpful. Question 38. A 7-year-old with asthma begins wheezing after receiving peanut butter. What is the nurse's immediate action? A. Call respiratory therapy. B. Administer albuterol via nebulizer. C. Apply oxygen. D. Notify the healthcare provider. Answer: B. Administer albuterol via nebulizer. Rationale: albuterol opens the airway and is the immediate treatment for bronchospasm. Other actions may follow. Question 39. A nurse is caring for a child with hemophilia who bumps his knee. What should the nurse do first? A. Apply a warm compress. B. Elevate the leg and apply ice. C. Massage the area. D. Administer aspirin for pain. Answer: B. Elevate the leg and apply ice. Rationale: elevation and ice help reduce bleeding in hemophilia. Warmth, massage, or aspirin can worsen bleeding. Question 40. A child with newly diagnosed celiac disease asks what they can eat. Which food should the nurse suggest? A. Whole wheat bread. B. Oatmeal with barley. C. Rice and grilled chicken. D. Pasta with meat sauce. Answer: C. Rice and grilled chicken. Rationale: rice and plain meats are gluten-free. Wheat, barley, and rice should be avoided in celiac disease. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.